Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about how a full-time dental associate's schedule can quietly expand. And what I mean by that is it's not uncommon as a dental associate for your schedule and your contract to say one thing, but when you get into practice, it may expand into something that you're not expecting. And I'll give you some red flag areas. So when you sign an employment contract, there should be some discussion about your schedule. So it should say, we expect a minimum of 36 patient care hours per week. Or we expect the dental associate will work 4 days per week with 10 hours per day, something like that. It can change for different offices. Many offices aren't open on Fridays, or perhaps you would be the only one working on Fridays. Some offices may expand into a Saturday, and it's not in your contract that you've worked Saturdays, but then they're pushing it on you that the expectation will be you will be working Saturdays. It's just important that the initial expectation should be written in the agreement. And then there needs to be language that says any change to your schedule needs mutual approval. So if it says you're going to be working a normal kind of 9 to 5 Monday through Friday and no Saturdays are listed, and then the practice says, you know what, we're going to do half days on Saturdays. They can't force you to do that if there's language in the contract that says they need mutual agreement to make any changes. So in that scenario, you would have the option of saying, no, I don't want to work on Saturdays. That's not in my contract. That wasn't the expectation. And you can't force me to do that. As far as hours as well, I think especially in the dental industry, kind of late patient pressure is always there, meaning if you're just well behind, or there's a bunch of late patients that you have to deal with. What you don't want to happen is that maybe you're on a daily rate, right? So it's pretty common for dental associates, and you're getting an $800 daily rate, but the expectation is you're going to work 9 to 5, but in reality, you have so many patients going over, maybe due to poor scheduling, or just an inefficient office, or the assistants and hygienists aren't on top of it, that you're not getting out of there until 7 every night. So you're getting paid for a kind of 9 to 5 position, but it's actually 9 to 7, and that should be reflected in your compensation as well. Or you should have the opportunity to say, look, I understand I'm a team player, but it's not fair that you're paying me X amount, but you're expecting me to stay for 20% more than what you're paying me for. So that's another thing you need to kind of be cognizant of is there consistent late patients, and then how to deal with that. Administrative spillover, and this is mostly for charting purposes. What you don't want to do is, let's say you're working a 4-day schedule, and then on the 5th day, you're just spending 8 hours charting or getting through admin work. There should be a reasonable amount of time for some kind of administrative duties. And as I said at the beginning of the video, it's not uncommon if you're working a normal 5-day schedule that you would have 36 patient care hours, and then they would give you kind of a half day for your admin work. But that would be worked into your schedule. It wouldn't be you work 4 10s and then a Friday, you're expected to spend half of your day completing all of your charting. It should be baked in to whatever your normal schedule is. And then I kind of mentioned at the beginning, but extra day creep. So if you're initially scheduled for 4 days a week at X amount of hours, you don't want them to go, you know what, we need you to come in for a half day on Fridays as well, but you're not going to get any additional compensation. Now in that scenario, it really would only apply if you were on some kind of base salary, but there should be at least some maximum amount of time that you're supposed to provide clinical patient care if you're on a base salary. Once again, if you're being paid a daily rate and they want you to work a little bit more, it'll be up to you if you want to do that or not. And you can make a little more money that way, but the choice should be yours. So anyway, that's a little bit how a dental associate's schedule can expand. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. Thanks. Take care.